not saying that my residency didn't prepare me, but every residency has its pros and cons in how they teach and what they don't teach to the residents. And the only way you're going to be a better orthodontist is if you take the initiative yourself and learn.
Hello there, orthopreneurs, and welcome to another episode of the Orthopreneurs Podcast. This gentleman who I have on today is somebody I've really looked forward to for a while to have, because he's a friend. He's somebody I've gotten to know pretty well over the last 5 years. And he's really, truly an inspiration to me on many levels. And so put your hands together, give a warm Orthopreneurs Podcast welcome to Dr. Jeff Lee. Welcome, Jeff.
Thanks, Glenn, for having me.
Oh, it's my pleasure to have you, my friend. So before we get into the nitty-gritty of your life and talking about all the great topics we're going to talk about, tell everybody a little bit about what made you want to become an ortho. Where did you go to college, dental school, ortho residency? Tell us a little bit about your practice and your practice life, and then we'll get into everything else afterwards.
So why did I want to become an orthodontist? I decided I wanted to be an orthodontist actually in the middle of dental school. I actually really originally wanted to be an endodontist, which is weird. Sorry for all those endodontists. Yeah, sorry for all those endodontists out there. I really wanted to be an endodontist for a while because I felt like, what they did was very technique sensitive. I have a lot of admiration for them because what they do is really difficult. Trying to go in blind to fix tooth pain is really difficult, and I think what transitioned me during dental school is when I had an ex-Marine come to a dental school for a root canal. And I was a third-year dental student trying to do a root canal on someone who hated closed spaces. So you can imagine someone trying to get in my face and punch me after an hour and a half into a root canal procedure.
Did he really try to physically assault?
Yes. He didn't like being at dental school. He was just angry. He didn't want to be in a closed, confined space. And so you could imagine someone who's training to learn how to do that procedure develops sudden anxiety. And I told my attending after that day, I don't want to be an endodontist anymore.
It's just a great side note right there that let me ask you, if you'd never encountered him, right? If instead of him being this nasty, in your face kind of guy, if he was a gentle, kind person, a grandmother, let's say, who sat there stoically and afterwards thanked you and baked you cookies instead of what you got, do you think you ever would have ended up as an endodontist, or do you think it just was never meant to be and this was just the one thing that pushed it over the edge?
I think it pushed me over the edge, but I also came to a realization too that I'm a very sociable person in the fact that I like to interact with people.
Right.
And from shadowing endodontists and getting to know the profession a little bit better, I came to the realization that, hey, I like talking to people and not just isolating myself in a chair all day. Not saying what they do is, I'm praising what they're doing. It's not for me.
No.
And
it's okay to say that. It's okay to say that. I was at a lecture once where a guy stood up, a consultant, in front of a whole room of all specialists and GPs and said about relationships and social. We're all trying to build social relationships except for you endodontists, because we all know why you became endodontists. And obviously it was a little bit of a generalization. He says, I never thought about it. He goes, you guys see somebody once, maybe twice. The relationship doesn't matter to you. You fix them, they move on. You maybe never see them again the rest of your life, and you're okay with that. And you nailed it. That's exactly the difference.
But I guess the pivotal moment, which made me want to become an orthodontist, was when I actually had to go through jaw surgery in dental school. I had a class 3 underbite ever since I was in high school, and I was always self-conscious of my smile. And my mom, especially my mom, and I still give her some shit today, where she would always make fun of my smile.
I have to warn everybody out there, do not listen to this podcast episode with your children around. I want to warn, if anybody knows Jeff Lee, do not judge this man, because he's the most warm-hearted, kind human being. Honestly, I'm not throwing platitudes at you here, Jeff. You're one of the most kind-hearted, warm human beings I've ever met in my life. But he's going to talk like a sailor on leave. I'm warning you of that now. So, Jeff, you be yourself, bro. But I had to interject there for a second.
It's
You
fine.
dropped
It's
the
fine.
first curse word.
Yeah, I'm sorry about that, but
it's okay.
My mom would always. I don't know if it's just an Asian thing, and I'm not trying to play race into it, but it made me really self-conscious of my smile. And so until I got the surgery, until I went through braces again, it definitely changed my attitude and my appreciation for what we do as a profession.
Yeah, not uncommon. Do you know how many people I've interviewed on this podcast who've been through orthodontic surgery? It's kind of funny because in the orthodontic industry, most orthodontists aren't eager to send their patients for orthodontic, right, for jaw surgery. And yet, such a huge, it's like almost like every residency at one point in your residency, there was one student in the first, second, or third year who had gone through or was going through orthodontic surgery, right? And yet, as a profession, orthodontists, and they'll say what they want on social media, right? But the overwhelming majority will talk patients out of orthodontic surgery when given the opportunity, right? And I find that very interesting because a large part of my practice is orthodontic surgery. But just since you're on the topic, I'd love to ask you, knowing what you know about it and the changes it made in your life, would you go through it again?
Absolutely.
That's the answer I get from every patient who gets orthodontic surgery. That's the answer they give.
Yeah.
Not even a pause, right? It's like instant. Why?
I don't care if I have some paresthesia here. I don't care.
Why are you such an ardent advocate of having gone through it? Tell everybody out there, what about your orthodontic surgery is why you give such a quick yes?
It's not just the ability to finally chew functionally appropriately. It's the ability to bring out your best self in front of others. Imagine trying to convey happiness to other people when you're unable to smile because you're self-conscious of how you look.
That's a great point. That is a great point. And so you ended up going through orthodontic surgery. You had a Marine yell at you, and you realized that orthodontics is the way you were going to go. So, where did you go to dental school?
I went to UCSF in San Francisco, University of California, San Francisco for dental school. Then I did, I went to UOP for undergrad. I was a bioengineering major, and then I went to dental school at UCSF, and then did an AGD for a year in San Diego.
Cool.
Got into my residency at Seton Hill, which is in Greensburg, Pennsylvania. It's in case you're not familiar geographically, it's in Western Pennsylvania, approximately an hour south of Pittsburgh.
Yep.
Yeah. And then came back to the Bay Area. December 2016.
Right on. And so you came right out of school, practiced on your own, or went into an associateship or, partnership?
My first job was actually as an associate for about, oh my God, I think it was like less than 2 months in Salinas, California. I just realized that, that's funny, actually. Now that you brought up a topic, I realized how much I knew and didn't know after graduating residency. I don't know if that makes sense. Like, you come out of residency with a general foundation, but then you realize there's so many different approaches to how to treat a patient. And not saying one's better than the other, but it made me realize I need to get educated fast. I need to build up my continuing education to develop myself as an orthodontist.
God bless you.
Not saying that my residency didn't prepare me, but every residency has its pros and cons and how they teach and what they don't teach to the residents. And the only way you're going to be a better orthodontist is if you take the initiative yourself and learn, and I did that during my residency too. If anyone knows me from my own residency, I would be the guy accessing free webinars online. I think that was like one of the first times I found out about Adam Schulhoff's name, and like other people's names out there. And I don't want to go into the names and details. I remember taking a surgery course with Tim Tremont, who's now the chairman of MUSC, but he was a pivotal faculty member at West Virginia for a while, and his practice was actually 20 minutes from my residence.
Wow.
So I was fortunate enough to take all 3 of his surgical courses. And do I know everything surgically now? No. I'm still learning, and I'm glad I have people in the profession to help guide me or give me input on and feedback on how I diagnose my cases, but it's great that, and I'm hoping with, Neil Kravitz and all these, and especially you, Glenn, bringing everybody together collegially, I think it's going to help us in the future to become stronger professionals.
I love that.
I'm not trying to stroke your ego. I'm just trying to be honest here. And, I think we're turning in the right direction.
Well, I appreciate it. And, you said something before that's really, really important to go back to, if you don't mind for just a minute. And you were talking about, you came out of residency and you knew you needed to learn a lot more. And A, that's unusual. B, you almost said it almost like apologetically, right? Like, I'm not saying anything bad about my residency. All residencies are different. And the challenge that I found in orthodontics is that you're talking about, achievers, right? People killed it in dental school, killed it in college, speak multiple languages. I've talked about this many, many times. The people, if you look around ortho residency at the people in that room who are around you, the credentials are incredible. And what I see in orthodontics, and not everybody, but I speak to a lot in my position, a lot of young doctors. Oh, I don't have time to take CE. I don't have money to take CE. I don't have the ability. I have a child. I have a family. I've got a spouse. I can't take CE. And I sit there incredulously because we are in healthcare. I don't care what this isn't going to make friends, but I don't give a darn what you as a provider have time for. You are working on patients. They deserve better than what you are coming out of residency. Not just a little better, a gazillion times better. Because if you think you came out of residency and you know everything and you just have to clean it up a little bit, you are sadly mistaken, right? Because again, I've had the foresight or the hindsight of 30 years of practice. Where I was when I left general dentistry, I was a radically different clinician than I was when I left dental school. And mind you, I took 1,000 hours of CE in my first 4 or 5 years. I can't keep track of the exact number, but I got my FAGD, I think at 5 years or 7 years, whatever the minimum was. And I had over 1,000 hours of CE at that point because I knew my patients deserved better. And it's part of why I do Orthopreneurs Summit. It's part of why I do Orthopreneurs University, because if you've got complaints and arguments that you don't have time to take courses, well, good, now you got it at home. Now you can sit at home and watch it when the kids go to sleep or the spouse is asleep, but our patients deserve better. And to quote the late, great Dr. Morty Amsterdam, who came out of University of Pennsylvania, the unfortunate part, again, is that most orthodontists have never heard of him. He is the godfather, the forefather of modern periopras. And he used to say, for every patient, there are multiple treatment modalities, but only one correct diagnosis. And all too often, we talk about being online. You mentioned you post a case and everybody tells you instantly what they'll do. Nobody stops and goes, okay, I've done it. Let's post our problem list. Let's post the diagnosis of what this patient is as I see it before I give you what I'm going to do to treat it. And so again, I think, I'm sorry for the ramble here, but you hit a really important point, which is we need to focus more on diagnosis and let everybody treat the way they want. You have 30 ways you can treat. Treat the way you want to treat, but let's agree on the diagnosis before we go any further. And number 2, if you don't think you need more CE, for sure you're the one who needs more CE. Because the ones who are taking a lot of CE recognize, like myself, how little I know and how much different I'm going to practice in 10 years than I do right now, right? You agree with that?
Right. It's funny. The other day, I thought I posted a pretty good case that I was pretty proud of. And I'm not going to name the name, but one person said, aren't you embarrassed by the crowding that's still present? And I was just like, excuse me? Like, what crowding is there? And then I was trying to be polite about it, but I'm just like, how come you never posted anything to like demonstrate, and I'm not trying to.
No need to apologize, Jeff. No need.
No, I know, but it's sort of like my feathers a little bit. I'm going to say that politely, that, there are people out there who are very staunch in their approach to things, and then yet they're too shy or shy in how they present themselves. Like, oh yeah, like I would definitely have done it this way. I'm like, all right, show me case,
right.
Because it's sort of embarrassing for you as a clinician to basically tell me how you would do it, but then you don't even show how you do it.
Right. And I cut my teeth, no pun intended. I cut my teeth in dentistry at a time when social media didn't really exist, right? I got on AOL originally, like 1992, 93, right? Like, so like whatever year, I remember having AOL come in the mail as a CD that I would install on my dial-up internet, bing, bong, bong, right? With the Netscape, browser. And I was already a dentist when that started. And I remember you'd go to meetings and you'd bring cases and you'd sit at the bar or you'd sit at and you didn't have a computer to open. You had literal slides, and people would show up at meetings with sleeves of slides to say, I need help with this case. And you'd have a light box. Like, you'd bring a light box. Like, as crazy as it's going to sound to people, I know people remember this. You would bring a light box. When LED light boxes came out, it was like a big deal because it was small. You'd bring a light box with you to a meeting so you could plug it in and show your slides. So people, your Kodachrome or Ektachrome, whatever it was, so people could then talk about like how to treat. And the difference was, I'm going to be not as gentle as you were, Jeff, because I've gotten to the stage where I really don't give a damn anymore, okay? I'm going to be honest with people. I think the people that are responding to you in that way are cowards and a-holes, okay? They're jerks in real life too. They're hiding behind a keyboard to cast aspersions at you, and they have problems in their own lives that I wish we could help them solve. Right? It's not that they're going to show you a case or not. There's an insecurity there that makes them feel better by attacking you. It's not about the case. It's about their ability to pile on to you about the case. And back in the day, growth really happened in a different way because I would present my case on a slide, on a screen, in a room with 100 people there. And if anybody had a problem with my case, they would tell me, Glenn, I don't like the crowding there. No, it wasn't crowding, but I don't like the porcelain work there. Really, let's talk about it. And now the whole room had a full conversation and the insecurities were cast aside. Nowadays, it's very easy for me to sit on the other side of the keyboard, see your beautifully treated case, not understand what you went through to do it, not understand about patient compliance, not respect that you're bearing your soul by showing your work, and just simply give you a negative comment. And it's just wrong. That segues us into another conversation that I know we want to have, which is self-doubt. Right?
Okay.
I know we want to talk because I know you well. And for those out there, I know Jeff now, not as long as some of you, but over 5 years. I remember single Jeff. I remember Jeff starting his practice, which we'll get to in a little bit, or buying his practice. But I know personally, and I know you're comfortable sharing this a little bit, like me, and like others, there's times where there's self-doubt, particularly clinically. Right? And you want to talk about that a little bit? Because I think social media is not helping this at any level.
I think you know me well enough too, Glenn, that I am my own biggest critic.
Oh, yes.
And the reason why I'll say that is because no matter what people say to me on social media, like even some of my closest friends and colleagues who help me, like I get their second opinion on like, hey, how would you treat this?
Right.
When they say something and it doesn't click for me, I get sort of down on myself, and not in a good way, because, I train so hard and I try my best to learn as much as I can to give the best possible treatment outcome for my patients. But it's one of those things where I've been struggling with, and, like I'm not perfect. Anybody who knows me well enough, like I'm not the smartest person in the room. There are way, way, way smarter people in the room than me. But if you ask anyone who works harder than Jeff Lee, not a lot of people, because I'll be up at 3 a.m. in the morning watching the Marco Rosa webinar that I was watching last night on canine substitution, stuff like that. Like if you ask me like, hey, what does Jeff Lee think about? I bleed ortho, man,
Yeah. And you're not alone. A lot of orthodontists bleed ortho. And again, I think balance is important in life, right?
Yeah.
And I always talk about the fact that I am an orthodontist, but orthodontics is not a big part of my life. It's when I'm in that office, I'm committed to my best patient care. When I have the opportunity to get an education, I take it, right, every time. But I also am a dad, right? I'm a husband. I try to be an athlete, not very successfully. I try to be a guitar player, not successfully. I have faith that I have to abide by that plays a role in my life. And I've said it 1,000 times. I'm not a funeral kind of guy. I'm not one of these people that says how many people are going to show up at my funeral is how valuable my life is. Because if I can touch 1,000 lives and none of those 1,000 lives know that I touched one of the other 1,000 lives, I'm okay with that. But if I told my family, if anybody comes to my funeral and says, he was such a great orthodontist, I want that person thrown out. Because that's not what I want to be remembered as. And I think all too often, especially in orthodontics, you don't see this in general dentistry. I don't see it in oral surgery as much I know probably about 45 or 50 oral surgeons. It seems endemic to ortho that people are so focused on their reputation as an orthodontist. Like, it matters how your fellow orthodontist thinks of you as an orthodontist. Like, they're all A-type achiever personalities. And I saw this thing on social media, so I feel like I need to do better because I saw that one hand-picked perfect case that was also cuspid substitution. And if mine doesn't look as good as that one, well, I'm not a good orthodontist because I'm not providing it. So I'm going to keep them in braces another 8, 12, 16, 18 months because I'm going to get to that ideal, because if I showed this on social media, people would judge me, right? And I feel like there's a lot of that going around. What do you think?
I think that's another discussion too. I try to aim for the best. And so sometimes if it does take longer for me to treat my patients, I just do it.
Right.
But I mean, I know how big of an investment it is for my patients to pay that much money. And so for me, I remember, and I'm not going to name names, but I remember my orthodontist basically saying, hey, it looks good enough.
Right.
And then I had an open contact, slight crossbite, all this stuff. And I'm like, if he just spent a couple more months working on my case, I wouldn't have to retreat myself with Invisalign,
right,
to tighten up that contact, to make my bite better. Did it take extra money on my part? Yeah. But can I sleep at night knowing that I did my best and I gave it my all? Yes, I can.
Amen.
Yeah.
Amen. I agree with you 100%. And the challenge I think we face as orthodontists, it's not life-threatening, right? Nobody's going to die. The old saying was that 97% of your patients will never even recognize a bad bite, right? Like 3% will, and you better be able to deal with that. But 97% don't know their class 2 end-on. They don't know full cusp class 2, or, unless they're, truly significant, class 2 or class 3, they don't recognize it. And so you could finish improperly very easily, but we drive ourselves. And the hardest thing for me, and I'd love your feedback on this, is the balance between, I have a non-compliant, the non-compliant patient's actually gotten easier. I'm very easy to talk to a parent a few times and say, look, the teeth are straight. I can't get there without them. I've tried my best. If you want to keep going, we can keep going, but this is a waste of everybody's time. It's the compliant patient where I'm trying to get that mesial root tip, or trying to get that torque right, or trying to get that locked in bicuspid area. And, I estimated 16 months or 18 months, and now they're into it for 20 months. And I'm like, the smile looks amazing. The teeth look really good. They're already happy, right? I've already met their expectation, but I see those little things and I struggle with, is it fair to the patient for me to keep going when they're already happy? I'm already overestimated treatment time. And what do I do? And that's the moral dilemma that I struggle with. The one who's been in treatment for 30 months that I estimated 16, that's not us typically. There's something else going on here. But those cases that are like 3 to 6 months over treatment time, that is on me because I didn't place my brackets appropriately at the beginning. Maybe I had to do a couple of repositions. Now I got to bend some wire. Maybe the elastic pattern wasn't really as effective as it could have been. A whole series of things. That's where I struggle with. And if I take them out, they're more than good enough. Am I doing them harm by keeping them in an extra 6, 9, 12 months? Where do you draw the line?
That's a really tough question to answer, Glenn. I mean, I look at hygiene, I look at morale of the patient the most.
Right.
Um,
right.
It is hard to get a patient to a nice, by nice, you're already there. Ideal.
Right.
Occlusion.
Perfect.
Perfect. You know what? I'm going to correct you. None of the cases I've ever seen are absolutely perfect.
Right.
They're just short of perfect, which is Uncle Ron's motto. Ron. But I would say that, without the compliance, without the morale, you're just shooting yourself in the face. I mean,
right.
Sorry being blunt about it, but it's just like,
true.
Make your patient happy. If you can settle the bite with a retainer, they'll settle. Chew gum. I have them chew gum if it's like there's a little bit of an inner occlusal gap, like just chew gum. They'll stimulate the PDL to move closer together, and then, it'll settle over time. But
I've seen that even with aligners, right? We always talk about this and it doesn't happen. Even with aligners, the bite will settle in, if you let it.
Right.
But do you think, I haven't spoken with a lot of older orthodontists about this, but what do you think the role of the more modern social media, right? Like, because, you're in Pearls, I'm in Pearls. I'm not as active there as I'd like to be, partly because once you start showing clinical cases, emotions come out that don't come out so much when you talk about management, right?
Right.
I don't need that in my life. I've got my journey. I love going in there and dropping, some comments here and there, but I don't live there as much as I should. I know you're an active part. What role do you think even the most well-intentioned social media groups, which Chris and Brian have done a great job with Pearls and really making it a good place to be, do you think that plays a role today in us wanting to keep a patient in treatment longer? Because, again, we see a lot of really well hand-picked cases that are thrown on screen. And I'd like to go back 20 years and see what an orthodontist 20 years ago was turning out if I looked at like 50 consecutive cases of theirs. Is this like ridiculous, or does it make any sense whatsoever?
No, it makes perfect sense. I think it's, when people post cases on Pearls or whatever social media platform, they're always presenting their best. I'm guilty of it. I want to show some of my worst cases, but I know that my morale will go down the drain if someone just constantly imagine trying to get criticized on your worst case, and it's a bad case, but you decide to show it anyways.
Yeah.
It's sort of like, I don't know if you've ever seen Game of Thrones, but shame, constant shame. You're like, whoa, like, all right, that's embarrassing,
But here's the thing: it shouldn't be, right? Like, we should be embracing, like again, I live in social media, right? You live in social media, but it's like the Kim Kardashian effect, or the Kardashian effect in general. The Kardashians have shaped the way women look at themselves, younger women, right? The shape of their bodies, the way the face looks, the way the makeup looks. All my team talks about the Kardashian effect all day long. And I think there's the social media effect when it comes to orthodontics, because we see these cases that look so good, and it might be 1 out of 50. Now, I remember seeing Sean Carlson show 50 consecutive finishes, I think it was. It looked beautiful.
200.
Right. Whatever the number was.
Yeah.
Dude, 50 is like,
I know.
It's like saying I ran a 4-minute mile. No, it was 3 minutes and 20 seconds. When he showed 50 consecutive finishes, boom, 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 I would have taken any of those as my finishes. And it just goes to show you that he's a master clinician. And I think, you take guys like him and Stu Frost, right? Like, I look at Stu's finishes and they are legitimately one after another. And I think part of it is a God-given ability to do it, right? I don't think just anybody can do it. But I think it's also a systematized way of treating efficiently, effectively, and more importantly, recognizing when things are going off course earlier, which I'm not good at, right? I've only been practicing for 7.5 years. I don't say that facetiously. I've been through 5 separate bracket systems through no fault of my own. And just learning the bracket systems is making life difficult. And I think, like you said, it's one of those things that, like, we'll beat ourselves up over it a bunch. And I appreciate our ability to talk about this right now. But I do want to jump into one more thing with you, because you have some great experience taking over a practice, right? A lot of people out there are going to start their own, or they're going to buy someone else's, or they're going to partner. And I think starting your own is easy in the sense that you know what you're getting. You step in, you build it. You really don't know what you're getting into, but you know what you're getting. You're a partner in a practice for a year or 2 or 3 or 5, and you buy that practice, you know exactly what you're getting. But when you buy somebody's practice, you don't know what you're getting. I don't care how good the broker is. I don't care how much due diligence you've done. You're going to go in on day number 1. If the treating doctor is not there, or the selling doctor, you're going to be very surprised about a lot of things, like buying a home, right?
Mm-hmm.
Give me, if Jeff Lee from 2022 could go back and give some advice to Jeff Lee, new practice buyer, what advice would you give yourself? And again, it would apply broadly to everybody.
Sure. Coming out of residency, wanted my own practice. And the reason why I say that, it's not just for everyone thinks it's like, oh yeah, I'm going to generate so much money and stuff like that. Yeah, I want to make money too. We didn't get into this profession without trying to do well for ourselves, right? But I wanted to be in control of what I was able to use in my practice. And that's the only way I felt like I was able to do that, because I could control what comes in, what comes out, for the most part in my practice. And so I would say, coming out, do your due diligence. That was one of the biggest things I did not do. And I was so focused on practicing where I wanted to practice that I let that sort of blindside me to the fact that, hey, yeah, you have a practice, but you have to look at the ins and outs of everything. And, I got a lawyer to help negotiate the deal and everything. And yeah, I did get the practice, but, and I'm fortunate that I was able to purchase the practice, but there was also things about the practice that I don't want to get into in this podcast, but it's just more like there's a lot of hurdles that I had to overcome in order to sort of make it the practice that I wanted to be. And it took, I'm like year 5. Yeah, I'm year 5 in. I originally was in a practice where there was a satellite office where I purchased the patients, and then I had to share space with a pediatric dentist. And it was great for a while, but then I realized, like, I'm not getting additional referrals from other offices because I'm in that office,
right?
And like, so I had to move out and then, build another office a couple cities over, and that cost a lot of money. And I got screwed over by a contractor here because he stated all the things that sounded great, but he didn't deliver. And I think a part of it now is just, and I really want, and this is where I'm going to thank my wife if she listens to this podcast, because without her, my office wouldn't be as nice as it is right now. She came in, she put her foot down, and she's like, hey, you need to do your due diligence, and we need to find somebody who's going to fix it. And yeah, it did cost me a little bit more, but I'm really happy with how my office looks right now.
Right on. And by the way, I want to drive. And by the way, I just want to say, Jeff, as a friend, I like hearing you say my wife.
Oh, thank you.
I like hearing you say that. And it's good to see you happy. You said do your due diligence. Can you go into that just a little bit? If you could go back and do your due diligence better, what does that really mean? I'm a new grad coming out of school. I've got the opportunity to buy a practice, and Jeff Lee has just told me, do more due diligence. What does that mean? What do I do? Can I just not trust my broker and what he's telling me or she's telling me?
Well, that's the thing, Glenn. I didn't get a broker. I didn't get a broker. I should have done more forensic analysis of the cash flow, ins and outs of the practice, the insurance billing, all that stuff. Looking at trends too, the collections look great, but how do I know that, these numbers aren't skewed a certain way, just in favorable for a sell of a practice? I don't know. I'm just throwing things out there. I'm not saying that necessarily applied to my case. I'm just saying, like, I've heard from other colleagues who've gone through this situation, who've, had to deal with like a lot of surprises when they bought the practice and then realized like, hey, this is not exactly what I was hoping to get.
Right. Right.
Yeah.
No, it's fair enough. I mean, you're everybody can learn from your experience. And again, you're one of the warmest, nicest guy. Everybody who knows Jeff Lee loves Jeff Lee. You're just one of these guys who's so giving of your time. And you make things so, it's going to come out wrong when I say this, when I say personal, but it's not, you want to take hold of every problem. You want to find a solution. You want to make it better. And that can take a real toll on you. It can beat you up because it's hard to put your head on the pillow at night. Right. When you think about it. And again, as we wind this down, I just want to say thank you for being willing to be on here today. So much I've learned about you today, which is great. I didn't know you wanted to be an endodontist. And, we get a chance to chat a lot in RD where we'll travel, see each other a great deal. And like the stories you gave today were fantastic. But, the one word of advice I want to give everybody that I took out of this today is just, everybody just, again, when you see somebody bare their soul online, recognize that, if somebody shows you their case or asks for your opinion, don't be a jerk. Step back and realize that, if you've got a similar case, show it. Not because you want to show off, but because you want to demonstrate another way it can be treated, perhaps. But just recognize that people posting, there's a real person on the other side of the screen when they're posting. And you could make someone's day terrible for no good reason. And nobody.
I've been at fault about that too, Glenn. Like sometimes when some of my closest friends asking for advice, sometimes I'm slightly dismissive, and I'm like, you know what, that's horrible. Like maybe I should take a step back because I probably know that area a little bit better than that person. And so like, I need to take a step back and realize like, hey, you're coming off like a jerk. This person's asking you for help. Do it. You're going to make their day because you just helped them solve a problem that they were racking their brains out for like hours on end, and I think that's where I'm going to reemphasize why I think Neil, you, and some other people in our profession are doing things in the right direction, or putting us and setting us up for success in the right direction, which is basically, like helping others. And I know it's like, I'm going to reemphasize this one more time before I stop, but helping others is, I think is it's not going to just help you mentally, but it's going to help you professionally too,
Absolutely.
And grow you as a person.
Yeah, I agree 100%. And again, the whole reason I did what I do with entrepreneurs is just, I want to see people live their most profitable, low stress lives. Like that's my tagline. Right. And, one thing I'll tell you here, it's the first time I'm saying it publicly, or announcing it, is that Orthopreneurs University, which we had, our semesters and courses and what have you, at around summit time in September, we're pivoting to Orthopreneurs Academy, which is actually going to be on demand, asynchronous learning, from micro learning of 5 minutes to, a 5-hour course where people can hop on for, you're doing your lunch hour, you want to get 5 minutes on leadership or management. We have speakers who are speaking on micro. It's going to be tagged like a Peloton. If you've ever been on a Peloton, I want a 5-minute lecture from so-and-so on leader. Great. Boom. Pops up. You've got it. And we've got probably 300 hours of content right now, and it's only growing. And so to your point, thank you for the kind words. Number two, every person listening here today, ask yourself the question, what are you doing to help make other people's lives better? It doesn't have to be in ortho. And Lord knows, I love what I'm doing in ortho, but I try to do a whole lot more outside of ortho that I just don't even talk about. But what are you doing to give back to this world? There's a point in your life you got to take. You're newly married, you got a new kid, you got a new practice, you need to take a lot because you need it. But put something back in the bank. Put something in the credit bank of helping people. And it doesn't matter where it is. Just do it. And I know you're definitely built that way, Jeff, and you're doing a lot of it.
Oh, thanks, man.
I appreciate that. And so I want to say thank you for being on the show today. I can't wait to see you next time, whenever that may be. Is that going to be at Summit?
Unfortunately, not this year.
Bummer.
In spirit for sure. And I just want to thank you once again, Glenn. Thank you for giving me the honor of being on your podcast.
The honor's all mine, my friend. Wishing you a great day and a great summer.
Thank you, buddy. You too.